Good morning and welcome to today's video. I'm Mary Felling. I'm a physical therapist, and for the last 25 years I've specialized in an area called the John Barnes Myofascial Release approach. Today I'm going to show you a technique for the quadriceps, also fondly called the quads. This is really good for those of you who are finding it hard to crouch down in positions, to get into yoga positions, or just to get on the floor and play with your kids or your grandkids. So let's get started. We're going to do a release for the quadricep muscle. You can do this in a chair, so it's nice. You can be at work, you can be outside next to the pool, or on a playground with your kids. You can be anywhere and do this. So you're going to get into a chair and you want to get to the front of it. So you're going to scoot your rear end to the front part of the chair. You're going to turn your body in the chair. One leg is going to be behind you. That's the leg you're going to be releasing. And the other leg is in front, just to give you some support, give you a more sturdy base of support. The foot that is back of the side that you're releasing is extended back until you begin to feel just a little bit of a pull here. And once you do, it might be down close to your knee. For those of you who are tight, down further on the quad towards the knee. This muscle goes all the way from here down to here, holds the kneecap, and then it attaches just below the kneecap with its tendon. So you're in this position, you've got that leg back, you're nice and tall, spine is nice and tall, and you're just going to do a little pelvic tilt. That's tucking your rear end under. You're going to lean back a little, and as you do that, you will find a beautiful stretch anywhere along your thigh. It might be towards the outside of the top of the thigh, might be just right in the middle. You might feel it high. You might feel it just above your kneecap. All of those are great positions. And for those of you who still are saying, well, I don't quite feel it, I don't know what to do, make sure you're at the very front edge of your chair. That leg is as back far as it can go. Make sure you've got some good support on the chair. Don't be so far off that you're working your body to stay on the chair. That'll kind of create a different problem. And what you want to do is be able to really have your body weight supported by the chair. So you've got your leg back. And for me, I already feel a stretch. I don't even have to tuck under. If you're still looking for the position, pause your video right now. For the rest of us, as you're in the position and you feel that elongation, it's all you need to do. You just want to maintain the position. If you squirm around and you're pulling back or forward, then the clock starts over. So it's once you're in this stretch position, then that 5 minutes begins. And remember, we're doing 5 minutes to help elicit that piezoelectric effect. So in our body, our fascia, that cobweb that surrounds, supports, and infuses all of our muscles, our ligaments, our tendons, our organs, your bones, everything has a sinewy cobweb around and within it. And when it tightens down, it binds down because of injuries or overuse or stress. It dehydrates and thickens and gets glued. And when it's like that, that's what causes the tension and the tightness in the quadricep muscle, or for any muscle for that matter. And when we apply a mechanical energy, and right now you're applying elongation, tractioning, telescoping, when a mechanical energy is placed into the human body for a minimum of 5 minutes, it elicits this piezoelectric effect. It's an electrical flow, and as that electrical flow moves through the body, it happens to move through the fascia. And when it comes to that area that's bound down, which we call a myofascial restriction, it helps it to rehydrate, soften, and elongate again. So part of the positioning when you're doing a John Barnes myofascial release is not only getting the stretch position in, but a little bit of tractioning. So while you're in this position, you're just kind of thinking of having that knee elongate down towards the floor a little bit. And it's just ounces. It's not a force. It's not something that you really have to think about and work hard on. It's just the ounces of effort, as if you're going to elongate that knee. You're trying to bring that knee down to the floor. So it's nothing that should exhaust you, nothing that you want to create another effort in. It should be effortless. So as you're in this position, we're coming up on 3 minutes. What you're feeling for, what you're looking for is a myofascial release. And it feels like taffy elongating, butter melting, softening in the area, less pain in the area. You might feel something pulling in another area. You might be here and going, you know, I start feeling that. I can kind of feel that pull up into my hip or my abdomen. You might feel it pulling towards your foot. That just is your body's way of telling you that the fascial restrictions have caused tension through the fascial web that have reached these other places in your body. And by doing this particular technique in the quad, in the myofascial component of the quad, myo means muscle, you are helping to affect the other tension through the rest of the cobweb in other parts of your body. So right now for me, because I do feel it coming up to this point, I'm getting a nice elongation all through this whole area. So it's kind of like a bonus area being treated while I treat my myofascial complex of the quadricep muscle, the quad. So while you're there, you're just feeling for softening. And you can even do a mind-body technique to help the body continue to soften. So you close your eyes and you want to see inside your body. And you want to see where the tight or tender areas that you have right now. And you want to see that area softening. Get a good picture of it first. Maybe it looks like tangled up massive ball of knotted up string or wire. Maybe it looks like a pile of bricks. Whatever it looks like, see it softening and moving out towards the surface of your skin. And as you see it moving towards the surface of your skin, see an opening in your skin for that pain or discomfort to move out of. And when you've gotten as much out as you can, then you close the opening behind it so that it can't come back in. All right, so we're coming up to our 5 minutes. So you're welcome to go longer. You can stay here 7-8 minutes. You'll just get more releases. You can also stop now if you'd like. And you can do this as many times through the day as you want, especially if you start feeling tension through the front of your thigh. For those of you who go to the gym on a regular basis and you can feel that you're really tight through your thighs, this is great for you to do when you get home, especially if you've been doing lunges, squats, that kind of a thing. All right, so when you come out of the position, very slowly bring your leg forward. You'll even feel that you got a nice stretch along the top of your ankle and the top of your foot. Come around very slowly, kind of put your weight forward on it before you get all the way up. And I hope you enjoy that. Thank you, and I'll see you on the next video.